Be happy to, and be happy to. Thanks, Sean. Um, Hi, everyone. My name is Ray Lyons. I'm the CEO of Kappa Health, and Kappa Health has been an online delivery provider of the National Diabetes Prevention Program since 2015. And Kappa became fully recognized for the delivery of the online DPP back in 2018. In the last few years, we have been replicating our platform and our content for health departments. And in return, the health departments are enabling their affiliates within their state. So we're going to talk about the platform today. We're going to talk about the support that we provide also. The support in regards to recruiting and qualifying participants for your program, and then also the training that we provide. And so we're looking forward to getting into all of this. And by the way, Sean and Shannon, if the background noise here gets too loud, please let me know. I'll switch rooms. There's a maintenance crew outside.
Thank you, Ray.
Sure. So everyone, to serve up the online diabetes prevention program, it is required to have a CDC org code, and that's a DPRP org code. So we will help you with this process. It's a simple application. It usually takes about 7 to 10 days, but it's only going to take about 30 to 45 minutes of your time. We will help you with this process. When you're ready to apply to the CDC, please reach out to your local health department. They will engage our team and we will help you with that process. And then to serve up the online diabetes prevention program, obviously you need to recruit and qualify your participants for your program. So we've created some materials for you. We have a one-page brochure that explains the program, a two-page brochure. We also created an onboarding video. And the onboarding video is pretty strategic. We'll talk about it in a few minutes, how it's a great tool to qualify the candidates for your program. And then as far as platform training and support, this is unlimited. We provide this on a regular basis. We have monthly roundtable and quality assurance meetings, and we'll be providing that for the Great Plains Tribal Organization, and we will have unlimited support for your teams moving forward. So when you are ready to strategize about deploying your program and training for the platform, we'll be available at your convenience. We have a large team. And with that being said, let me switch real quick here. So sorry about this, everyone. Let's see here. So just to show you real quick, we do have platforms deployed in Nebraska, in Iowa, in South Dakota, and North Dakota. And depending on which state you live in, you will utilize that platform, but we will direct you to the right platform and the process when you're ready. This is the Iowa platform. Here's the North Dakota platform. The South Dakota platform. And then if you utilize the platform to deliver the National Diabetes Prevention Program, you're going to have access to a few interfaces. The first is the participant interface, and that's what we're looking at right here. And this is how the participant engages in the program. They watch their weekly video modules. Most importantly, they engage with their community coach. And when it comes time to demonstrate the platform, we'll cover all the capabilities, all of the content, and all of the modalities in which participants can engage with their coach. And besides the coaching platform, and this is the, besides the user interface, this is the coaching interface. And the coaching interface, again, allows the coach to serve the program up and also provide a very high touch program. The coaches, one of the differences between the on-site DPP and the online DPP is that the on-site program only engages the participants once a week. And then when you go into post-core, once a month, as you know. The online DPP, when it's served up on this platform, allows coaches to touch the participants as often as they like. And we recommend that coaches take 5 to 10 minutes each morning to reach out and touch participants. And we'll talk about that when we demonstrate the platform and all the collateral that's available to you. But the platform's highly interactive and it's developed to provide a high touch. And one of the strengths of this platform is that, your communities will decide who the coaches are. So, we'll provide the content for the National Diabetes Prevention Program, but it's your community coaches that will be delivering the program. And that's what will be so effective, because instead of somebody, a distance away or isn't that familiar with your community and your environment, you'll have a community coach serving the program up. And we think that, that will work out really well within the Great Plains. So with that being said, I would like to pull up the collateral that we've created. And give a new share here. And this is the one-page brochure that we've created. And as you can see, at the top, it talks about weight management, chronic disease prevention, lifestyle management. The reason why we draw those out is because we've found through research that many pre-diabetes individuals, are hesitant to join, programs that, talk about diabetes. It's a negative word. And the fact is that this program and the National Diabetes Prevention Program is great for weight management. It's great for overall chronic disease prevention. It's great for lifestyle management. But this is the brochure, as you can see. Say hello to the online DPP. And then we talk about the bullet points that the program addresses. Obviously, it's the National Diabetes Prevention Program. It's a proven curriculum. You work with a lifestyle coach from your community. Photojournaling meals is a great way for the coach to keep participants engaged. And when we get into training for the platform, we'll cover all of that with you. It's made up of 26 modules over the course of 12 months. The unique thing about this platform, it's not like serving up a Zoom session where you have 15 to 20 people live on the other side and you have to, provide, quality control for 15, 20 people. It's hard to go over that, as you know, with a live group. This platform allows participants to engage at their convenience throughout the day and throughout the week. And same thing for the coach. And we'll emphasize that when we train, but one of the strengths of the platform is it truly allows participants to engage at their convenience and therefore allowing programs to scale beyond the typical 15 to 20 individuals. But this is the brochure. This one's for South Dakota. We have one for Iowa, for North Dakota, and for Nebraska also. So you'll have these available to you. Let me pull up the 2-page brochure. So this is our 2-pager. Talks about what's involved in the program: lifestyle coach, evidence-based solution, online community, data tracking, photojournaling of meals, real-time coaching, sustained weight loss. Additional features of the program: dedicated community, lifestyle coach. And again, can't emphasize how important that is and how well the local community coaches are received. Participants dashboard for reporting. I'm working with members of your own community, as we mentioned. As you can see in the bottom here, this is a general 2-page brochure that can be utilized by all 4 states. but here's the contact information for each state. So you'll have as affiliates the option, you can reach out to Sean and Shannon at the Great Plains and Wellness Council, and they can pass you to the appropriate contact, the appropriate State Department contact, or you can reach out directly to your local Department of Health with Kayla from South Dakota, Bree with North Dakota, Brian with Nebraska, and Andrew with Iowa, all on the call today, and we'll be speaking shortly. They're the contacts that manage the platforms within their state, and we'll make them available to you and also allocate the resources for you. So those are the brochures. And what we've also created is what we refer to as the onboarding video. And the onboarding video, as you can see, it's about 3 minutes and 45 seconds. It's less than 4 minutes long, but this has been developed for participants, for candidates of the program. And what this video does is it explains how the program works on this platform. It also explains the objectives of the program to, lose 5 to 7% plus of your body weight, to sustain that weight loss, and to engage on a regular basis. But what this video really does that benefits us as providers and coaches is it drives home expectations that we have as providers of participants if they join the program. And our expectation is really just engagement. We just want participants to engage each week. And we know from patterns, as long as participants engage, success and engagement go hand in hand. But that's what we really expect, engagement. And what you'll see at the end of this video, and this is what we strongly recommend as providers that you do, is that at the end of the video, it's going to direct the candidates that if they want to move forward with this program, that they sign the commitment form and they send it back to the provider. And we think this is extremely important in regards to really setting proper expectations with the participants that want to join your program, and also qualifying those participants. Because in all honesty, if a candidate for your program can't watch a 4-minute video, sign a commitment form and get it back to you, they're probably not ready for an online behavior change program yet. And doesn't mean they won't be in the future, but this is a great way to qualify participants, really set expectation, and then qualify participants in a 5 to 10 minute process on their own. And as a provider, what you're doing is waiting for those signed commitment forms to come in. So I'll go ahead and play this real quick. If there's any video problems, Sean, please let me know.
Hello, thank you for your interest in the National Diabetes Prevention Program. This video will explain how the program works, program objectives, and the
I'm sorry, everybody, I should have mentioned also, this is our original onboarding video. We are adapting this video to be culturally sensitive to the Native American communities. We expect to have this out next week. As soon as it's out, it will be circulated by the Great Plains team and the Departments of Health. So this is the original, but we are adapting this for the Native American population.
Hello, thank you for your interest in the National Diabetes Prevention Program. This video will explain how the program works, program objectives, and the expectations if you commit to joining our 12-month program. This program is all about behavior change, improving your health, and preventing the onset of diabetes. What is the National DPP? It is a 12-month curriculum-based program that assigns you to a lifestyle coach. The program focuses on a variety of topics to help you lose weight, eat better, get active, reduce stress, and prevent diabetes. How does the National Diabetes Prevention Program work? First, you have to qualify for the program. Individuals that have prediabetes through blood tests or have a high risk of having prediabetes through a health survey qualify for the program. You can ask your doctor for a simple A1C blood test or take a quick online health quiz at doihaveprediabetes.org. If you qualify for the program, you can use the website dashboard or the mobile app on your phone. Each week, participants interact with their coach, read the lesson content, and watch a weekly video lesson. Your coach will guide your program experience, educate you, support you, and encourage you at your convenience. What are participants' most common objectives from this program? The most common goals for participants start with preventing diabetes, losing weight, reducing the risk of heart disease, and improving energy. Here's what our program participants are saying. I've lost 37 pounds, and all of my biometric data has improved. I no longer suffer from erratic blood sugar symptoms, and I've gained so much valuable knowledge from your coaches. Keep up the wonderful work. Jessica W. What I love about the program is that it is not a diet. My coach has made me aware of added sugars and the cost it has on our health. I've gotten better at shopping in the market, looking instead to healthier options. Harold P. The DPP is an engagement-based program that includes weekly curriculum modules and a lifestyle coach to manage your 12-month program experience and provide unlimited private counseling, guidance, and support. All coaches are trained to deliver the National Diabetes Prevention Program. The weekly curriculum modules include these topics. As you can see, the program includes important modules on nutrition, physical activity, mindfulness, stress management, and sleep. How do you achieve success in this program? The answer is through engagement. The National DPP is an engagement program that produces results. To achieve program success and meet your health improvement goals, you must engage each week and truly commit to changing your lifestyle. First, you need to ask yourself, is this a good time to participate in the DPP? Do you have time to review the weekly content? Do you feel comfortable using a mobile app or computer to engage with your coach every single week? Do you feel motivated to make lifestyle changes at this time in order to reduce your risk of developing diabetes? If you feel the timing is right for you, can you commit to the following? Can you commit to engaging with your coach each week? Can you commit to following the guidance of the program and the advice of your coach? Oh yeah, and did we mention, can you commit to engage every single week? If you are ready to move forward and commit to this 12-month program, please ask your provider for the commitment form and how to move forward.
Well, thanks for sitting through that, everyone. But as you can see, it's a short video. It's 4 minutes. It directs the candidate at the end of the video to sign the commitment form and send it back to the provider. So as a provider, the strategy is that however you go about qualifying the candidates for your program, go ahead. We have a lot of materials to help you. We have materials beyond what we just showed you today. So we have a lot of materials, but you can use our materials. You can use, your own, your process of qualifying individuals, but we highly recommend you finish by sending, an email with a link to this video to, the candidates for your program, and send them a commitment form also. We'll give you an example of a commitment form. A commitment form is just, saying this is what you can expect from us as a provider, a proven curriculum, professional advice, et cetera. And then, what do we expect from the participants? We say engagement 5 different ways that participants will engage each week, that they will engage with their coach, that, they will respond to their coach, especially with the new 2021 standards. And then we add a signature line to it. And again, the process is for you to send this link out to this video to the candidates, to send a commitment form also, and then as the provider, wait for those signed commitment forms to come in. Because again, we do expect participants to engage in this program for 60 minutes per week. So a qualifying process that should take 5 to 10 minutes should really kind of filter out those that aren't ready to join yet, and really identify those that are. So these materials are available to all of you, and the support from all of us, your local departments of health, and also from the CAPA team representing HALT. We will strategize with you. We will help you with the DPRP process. We will have ongoing quality assurance and best practice sessions, as you deploy. We want you to be successful deploying this. We want this to be a go-to for your team. And with that being said, now I will probably pass this over to, let's see, who was going first, guys?
I think we're gonna have Bree.
Bree?
You go
Oh,
first.
Thanks, Ray.
Yeah, thank you. That was fantastic. And if you want, Ray, you can put up the agenda
okay.
form that you had. That'd be great to let everybody know. But yeah, without further ado, this is Bree Monahan, the Diabetes Prevention Coordinator of North Dakota. We're very happy to have Bree on here. And go ahead, Bree.
Thanks, Sean. And thank you everyone for joining. We were very fortunate to be able to launch our online DPP platform this past January. As Ray can attest, it took a long time to get it through, to get our contract through. And I spent a long time researching this platform along with several other platforms. And what I really came to love about the platform that Kappa Health has is the ability for local programs to use the online platform. Many of the other organizations I looked into, they provide the platform, but they also provide all of the coaches. So it's kind of a canned program. With this, you really can have local coaches serving their own community, which I think is the most effective way to do this program and pretty much any other kind of program that involves lifestyle change. It also helped that South Dakota launched their platform first. So I was able to ask Kayla a million questions and view their platform online before we went live with ours. And I've also been very impressed with the technical assistance and support that Kappa Health provides, both to myself in the process of launching the platform, but also to all of the organizations that onboard the platform or just are even interested in looking at it. Ray's team is really great about meeting one-on-one with any organization that's interested, walking them through the platform and what the steps are to get started. So that has been a huge asset for us. Pre-COVID, I felt very strongly that North Dakota really needed some kind of online solution for the National DPP. Like all of our states, we have a lot of barriers, especially related to transportation and geographics in people getting to these in-person classes. So COVID made it even more apparent that we needed this, and it was really great that we were able to go live with it this winter. So it is available to any program in North Dakota, any organization looking to do an online DPP and at no cost. So I'm available to provide support and technical assistance for that, as well as Ray's team. So again, don't hesitate to reach out to me or to Sean or Shannon if you're interested.
Thanks, Bree. Andrew, do you mind jumping in and introducing yourself?
Yeah, sure. Thanks, everyone. Appreciate being here today. I appreciate all of you tuning in to listen. My name is Andrew Manier, and I'm the Diabetes Primary Prevention Coordinator with the Iowa Department of Public Health. It's almost going to sound similar to Bree. Bree, you nailed so many points that have been going through my mind lately with HALT and the need for it, the accessibility of it, the team that provides the technical assistance. So in Iowa, we started our program, our HALT platform, shortly after this new year started. It was sometime in January. And so we launched in January. Our URL is preventdiabetesiowa.com. And much like Bree, I had a lot of back and forth with Ray. I was emailing other platforms or other states that had their platforms up and going. And so there was a lot to do with trying to figure out if this was for Iowa. But then once we got going, it was a lot of the fun part with the customization of it and trying to make this fit and then really working with our local providers, our organizations that provide diabetes prevention programming to adopt the platform as well, which they have, and they've kind of hit the ground running with it. So with the CDC, they took a little break with providing new CDC recognized applications. And since then, we have right now 11 programs in Iowa that are on our HALT platform, and which is really, really great. That brings our number up to, in programming in Iowa, up to about 40 right now, which we were at 29. And we've had just I've been overwhelmed kind of by the acceptance of our programs, our local programs, and their readiness to move into virtual, online, or even combination setting using HALT. They're very ready. They're very focused on next steps. We have many programs in Iowa that are gearing up to start their first cohorts this summer using HALT. Actually, we have one of the attendees here, Jennifer Scales, is at our Meskwaki location for Sac and Fox, and they plan to start a cohort in July. So they are going to be one of our first groups in Iowa that start a cohort using HALT. So with that, I guess I'm really excited about the way HALT is going to provide access to so many. I echo that same sentiment that Bree and I had about wanting to keep our programs local. We didn't want to outsource those coaches. We didn't, and I'm sure many other states here, Brian and Kayla, wanted to keep the programs local. That was huge, and I think that's we want to take away from what they've already established. So I was excited with that HALT had that option. That was pretty much the sticking factor for me. But let me know if you guys have any questions. I will put my information in the chat there. And always feel free to holler this way in Iowa if you have any questions. I appreciate it, everyone.
Thanks, Andrew. Brian?
Good afternoon, everyone. It's hard to follow some of my colleagues, especially since they've said almost everything that I'm gonna say as well. But so my comments ditto. But what I want to say is I want to tell you a little bit about Nebraska's story, because it's awesome to see South Dakota, North Dakota, and Iowa already implementing HALT and seeing some great successes. We are in the process of launching July 1, and I'm still sticking to that. We're so close to being ready to offer HALT in Nebraska. But let me tell you a little bit about Nebraska's story. So majority of our national DPP sites, which there are about 32 across the state, majority deliver in person. And with COVID coming around, almost every single site had to stop their programming. And this was a realization and an opportunity for us to take a step back to say, we are missing an opportunity to have another tool in the toolbox to deliver national DPP. And so as an organization and as the chronic disease program at DHHS here in Nebraska, we decided to take a look and scan where we were looking across the nation of what was a platform that, one, met the culture of Nebraskans, two, utilized our greatest resource and assets, which are our lifestyle coaches, which we have 70 active lifestyle coaches statewide. And how do we ensure that we deliver a quality program on a quality platform and people can engage and be a part, either individually connecting with their coach or individually connecting with their cohort partners in that process. And we were led to HALT. And the reason we led to HALT is really that local onus. I personally, if I jumped into the program and I had a lifestyle coach from New York telling me during the winter to go outside and walk and be physically active, that doesn't pertain to the culture of Nebraskans. Plus, we'd freeze a little bit too. So I really wanted to make sure that we valued and utilized our greatest asset, those lifestyle coaches, to have the cultural context, to have the context of Nebraska and everything that has to do with what we were trying to promote around the program. Now, currently, our focus right now is to actually roll this out to our 31, 32 national DPP sites across the state. We are actually very interested in working with the tribes as well. So if you currently are not implementing national DPP and HALT is a tool that you think could be deployed and effectively implemented within your community, glad to talk with you. I saw a couple colleagues from Ponca that are on the call today, so I'm really excited about that. So it'd be awesome to reach out to you. The next steps I want to share with you are, we're going to finalize this by July 1 and kick off. if you're interested in participating, you can give me a call. We can talk through. The biggest thing for me that I'd love to know more about what you're looking for, how it's going to benefit your current residents, the people that you serve, and how can I be an asset for you to deliver your program effectively. This isn't DHHS coming in to say, here you go, this is how you're going to do it. Rather, I want to say, we have a platform, we have a tool. How can we be partners in promoting this program and supporting your local diabetes prevention efforts locally? So thank you for your time today. And again, ditto to Brianna and Andrew and what Kayla's about to say. So thank you.
Thanks, Brian. Kayla.
Hi, I'm Kayla McGee. I'm the Diabetes Program Coordinator for the state of South Dakota. And we get to be the honor of being the first state to launch the HALT platform. We've had our platform for, I was trying to count, 20 months now, almost 2 years. So we had it started before COVID, which was a great blessing for our programs because they started seeing the struggles of meeting in person and were able to switch over to the platform as an option. Some programs still decided to either close their program or go through Zoom just because of the technicalities of their organization and being able to adopt the platform for legal reasons or whatever. But anyways, our program got started out of the need, knowing that we live in a rural state, and getting programs started and getting programs recognized was very difficult. The CDC recognition standards and being able to meet those over a long period of time seemed unsuccessful for many small towns. And so we were mostly seeing our diabetes prevention programs in our more urban areas. And I wanted to be able to create an opportunity where those in the rural communities could have access to the DPP, especially when we think of the culture in our state, a lot of farming and ranching. And for individuals that work in that industry, you do not have a set schedule. You cannot make a set time on Tuesday night at 7 work for you every week. So we just had to be able to find that flexibility. And this platform was able to check all those boxes for us, especially as Bree and the others mentioned, having our coaches in our state and being able to understand and relate more personally with the individuals was a great positive when it came to this. Also during this time, we launched our campaign around prediabetes awareness in South Dakota, and ironically it shares the name Undo the Risk as this webinar. And so if you go to undotherisk.com, you get to see some of our comical commercials and take the risk test that would qualify you for the National DPP. And then you can learn about the diabetes prevention programs in the state and where maybe one is available to you. We don't have a lot of information on there about our online programs because they're very organizational specific at this time, but we're working to expand it so that anybody anywhere in the state can go to that website and get connected with the diabetes prevention program, even if that program is 3 counties away. They can still be part of that program. So we're really excited to be able to expand this reach out to individuals. Trying to think of anything else. Everybody did such a great job covering some of the aspects of it. I will say, from a coach's perspective, when from going from in-person to online, it can be tricky because you don't get to read that body language, and it's harder to get that camaraderie. Getting the participants to engage with each other when they may not know each other can be a challenge. And so I encourage you as lifestyle coaches, when you're looking at this, be ready to up your game as a lifestyle coach and start challenging yourself on how you can create more engagement with the participants. Just that's even, through the platform, outside the platform, challenge them to do certain things, create competition. That's always a great way to get people moving, just to really bring more engagement to the platform. Also, we have one facility in our state that's doing a hybrid type option. They're meeting in person, but they use the Live Your Best website as a tool to keep individuals engaged in between. And also a great way for them to track their meals, because taking a picture of your meal is sometimes easier than sitting down and writing out each of the things you ate, or using like an app like MyFitnessPal and putting in each item you ate for breakfast, lunch, and dinner, which is a great tool when you want to calculate all the calories and everything. But sometimes individuals just want to show what they ate. So taking the picture with the Live Your Best app is a great way. I will put my information in the chat box as well. So if you're interested in using the website here in South Dakota, just reach out to me and I can share all the resources we've developed and get you connected with other people in the state that are already using it, so you can get some peer support as well.
Thanks, Kayla. That's great. And everyone, just so you know, my organization works with the health departments all across the country. And I really think, between North Dakota, South Dakota, Iowa, and Nebraska, you guys really have access to, diabetes prevention coordinators who truly care about enabling, providers and increasing the adoption rate of the program within your state. And, we're big fans and in awe of these 4 leaders, and, very grateful for the 4 of you. And let's see, with that being said, we're leading up to Kamiko Garcia. And, we're really pleased to have Kamiko join us today and speak. Kamiko is running a cohort with the MHA Nation, and I'll let Kamiko give the details. I believe it's about 3 months in or so, but Kamiko, how are you?
Hi, thank you for having me. Like Ray said, my name is Kamiko. I'm here with the diabetes program in North Dakota in Newtown. And we are currently in the end of our week 18 of HALT, and it's been going amazing. Before COVID, we were doing face-to-face DPP, and our participation wasn't quite where we wanted it to be. With the face-to-face, we would kind of end up with maybe 1 participant or 2. Right now, we currently have 17 active participants in week 18. So big success, we're loving it. Our participants, they're having a great outcome with their weight loss. They're having anywhere from 5 to 23 pounds lost so far. So they're doing great. A lot of the feedback we get is they're loving the ability to be able to do the classes at their own convenience for time. A lot of them are working or they have families in the evening. So being able to do the class when they're able to is one of the big benefits with this. So yeah, we're getting a lot of great feedback with it. If there is some who we might see are struggling on keeping up, we reach out to them on a daily basis. So that's really great that they don't have to wait for that week later to communicate with us. They can just send us a message or call our program. So that's a really great perk with this. I know we will be starting another cohort later this fall in possibly September or October. So we're looking forward to that. So with the online, it's really great for us too, because we're able to cover, we have 6 communities we cover. So with this, we're able to reach all of them, not just one community at a time. So that's really beneficial for us. So we're really loving this online HALT here.
Kamiko, thank you so much.
Yeah.
Love the detail. There might be a few questions for you, not really sure. We'll get into a Q&A soon, but everyone did want to also mention that you'll be hearing from Sean and Shannon soon, and we'll put together a monthly roundtable session where we cover training, we cover best practices, we answer questions, talk about recruiting and so forth. So just monthly sessions, and again, we'll be available each week. So whenever you need the team, we'll be available. But we'll also have monthly roundtable sessions where everybody's invited. And again, Sean and Shannon will pick those dates. And with that being said, Sean, should I hand this back to you and Shannon?
Yeah, that's fantastic. Man, this is so much fun. This is great to hear everybody's story. I couldn't have asked for better presenters, really. Bree, Andrew, Brian, Kayla, Kamiko, Ray, phenomenal. I love everything that you guys are doing. And I absolutely love this opportunity. Like, this is something really special. I just mentioned to everybody before everybody joined that it's not often that so many different organizations can come together with a common goal and unite and push forth. And I think that's what's happening here, and it's very, very special. And so we're just super proud to be a part of this. Like I said, this is really a great opportunity. And I keep hearing all these reiterations of all the benefits, and 4 things really keep popping to mind. I just wanted to bring them up to kind of reiterate like how amazing this really is. The first thing is, the participants, they can engage at their convenience, which is something, COVID or post-COVID, whatever, pre-COVID, is something very, very special. You can do it at your time when you need or when you have available. Like that's something that a lot of other platforms, especially in person, is just not an option. So that's really, really great. The second one is you are working with a local community coach. Like this is someone that knows you, that knows your area, that you can see at the grocery store. As Andrew was saying, if somebody's from New York, like they're not going to be able to relate to South Dakota in any form. So, I mean, having a local coach, someone that you can actually probably go see if you actually need to, invaluable, very, very special. Third thing, the process in itself, the platform just increases engagement because there's so many different ways to interact and keep that participant engaged in the program. And the more you engage, like Kamiko said, sometimes they talk to their participants every single day, which is amazing. And you don't get that with other programming. So that's very special, very personal. And that just shows a long line of continuation on the part of the participant. And then the last thing 4 was just, it only takes 60 minutes. And because of its online platform, that's not 60 minutes and then 20 minutes to drive home or 30 minutes to drive home or 40, everybody, we're all from rural communities here. And so that drive time or even having to set aside someone to babysit the kids or, do something else to watch your mother, something along those lines, you don't have to do it with this program. And so what it does, I see ultimately, is provide people with a whole lot of freedom. And that's something very special. So with that said, I'd love to open it up for some Q&A because I'm sure there's a lot of stuff that we didn't touch on. So if anybody has any questions, feel free to unmute yourself or type into the chat or Q&A box, and we'll just open it up for open discussion and see where it goes from there. Let's see. There's a question. Yeah. So here's a first question. Is there a fee for participants to join the program?
You want me to take that, Sean?
Whoever would like to take that, go ahead.
Andrew, Kayla, Bree, Brian, you guys,
I'll chime in. So here in South Dakota, there currently is not a fee for the programs that are utilizing this platform. Although I do leave it up to the programs to decide if they want to charge their participants or not. So you may run into that depending on the program that you join. For programs to use the platform, that is absolutely free from the South Dakota Department of Health. Any program that wants to use the platform sure can for free, and it's up to the program if they want to charge their participants.
And I think I could probably go ahead and say it's the same for Iowa, North Dakota, and Nebraska. And the Departments of Health, they've all secured the licensing for years, and they're making it available to you as providers for no charge. And as Kayla mentioned, what you decide to charge participants is really up to you. Now, this platform and the capabilities, gives the providers, you as a provider, the same tools that the very accomplished online providers utilize, such as the Omada Health or the Livongo or Canary. And these organizations charge $450 to $600 plus per person for this 12-month program. And I explain this to you because, you know, it's that type of premier program. And, you know, at Kappa Health, when we were serving up directly to participants, we would charge $450 to $550, depending on the scenario, but at least $450. Now, the great thing about what the health departments are doing is securing the licensing and allow the affiliates like yourself to utilize it for free. So therefore, you know, lowering your, you know, cost per participant down to whatever your coaching costs are and whatever your administrative costs are. So, you know, to be able to pass that discount on to the participants that, you know, your communities, you know, is just worth its weight in gold, just because the fact that, you know, we can engage more individuals. You can charge, you know, whatever you need. But the nice thing is, as you can lower the cost tremendously, so we can serve more people and increase the adoption rate. And if you're working off stimulus dollars, you just can reach that many more individuals with the same stimulus dollars. So whatever you want to charge, that's really up to you. But you know, the platform is the same capabilities that those providers charging $450 to $600 plus per participant. That's the tool set that you have here. Good question, though. The platform is also being used for Medicaid, and soon when Medicare, you know, approves online DPP, it'll be utilized for that also. The platform can be used for the specific online DPP, but it can also be used for the combination DPP. And that's if you want to do a combination of both on-site and online. And there are some providers utilizing it that way also.
Opportunity. Knock, knock, knock. Answer, please. I think it's so great. One of the other things I wanted to touch on was how customizable this tool is. I don't know, Kamiko, I'm kind of putting you on the spot, Kamiko, but if you have anything to add about just how imperative it is to customize what you're doing to the community that you serve. I think it's something super, super important. Us at Great Plains, we always try and customize everything that we do to our cultural values that we're trying to uphold. And in so doing, we tend to get better response from our populations. And I was just wondering, Kamiko, if you had any, you know, any side note on how great that and customizable this option is for you and your partners, or you and your population.
Yeah, well, here, because we're on the Indian reservation, so of course every program, when we go to trainings or anything, we kind of customize it ourselves to make sure we can apply it towards our native culture and our communities. So with this program, it's really great because we're able to do that. So especially being where we are, we don't have much around us, everything's so far distant. So that's kind of the struggles we have here. But I feel like, I don't know how to say it, but yeah, it seems like there is things we can do, like incorporating like our food habits and all that. And when we discuss, like you said, having a coach from New York, that would be hard to follow for us here in North Dakota, especially we all have our own habits here, which would be very different from a person from a larger city. So having us locally kind of being a local coach, we understand each other and our participants rather than someone from like a different state or such.
Yeah, it's well said, Kamiko. And, you know, on top of that, just want to let everybody know that, you know, coaches also, you can upload your own content into the platform. So as you have collateral, as you have handouts that you want to give, even short videos, the coaching interface allows coaches to upload their content and, you know, utilize it in the platform. So the platform will come with a tremendous amount of content, and that content is the video modules, the lesson plans, the facilitator guides, and collateral to complement the messaging throughout the year. But besides that, you are welcome to, include and upload your own content that you'd like to pass out to, your community.
That's great. Customization even further. I think that's so important, because everybody is different. Every culture, every community is different. And when we can adapt to them, just magic happens. I love it. I saw in the chat here, Terry Elkins says, Medicare is allowing for participants to take the DPP online during the public health emergency. So 90% of their DPP participants are Medicare.
Yeah, and I will add to that too. So for right now, for Medicare participants, they do have to have a digital scale that interlinks with the platform, and we have the Kappa platform, and the Fitbit interlinks with it. So for my Medicare participants who are doing it online, I get them the Fitbit scale, so it just electronically uploads to the platform.
Oh, that's awesome.
Yeah.
Thank you, Terry.
Terry Elkins, a close contact of ours, as Terry mentioned, works for Sun Health, runs the diabetes program, amongst other programs now over at Sun Health, but runs a great program, and led Sun to be fully recognized for their on-site program with very high accomplishment numbers. It's a great program that Sun Health puts together.
That is excellent. Well, if we don't have any more questions, I think we've covered all the bases. I think we've showcased how much or how great an opportunity this really is. I'd like to thank all the panelists again and participants. Thank you all for being here. I think this is very important. Like I said, this diabetes affects everybody, every part of our culture and society. So the more we can get together and create something that can help people change in the long term, I think the better we will all be. So thank you all again. Seriously, this is really nice. This is something very special going on right now. So Terry entered her contact information. We're going to share that, Terry, also in our follow-up email, along with all of our presenters' contact information as well. We'll also send out the recording of this video, and I think that's all we have today. If anybody would like to say anything else before signing off, go right ahead. Thank you. Thank you all. All right. Appreciate you all. We'll see you next time.
Thanks, everyone. Take care.
Thanks for having us, Sean.
Looking forward to working with you.
Absolutely.